Welcome to another episode of the Manta Cares Patient from Hell podcast club. My name is Mike Linn, and while I'm usually the host of the show, today I will be playing the role of the guest while I'm being interviewed by Marissa Watland. Today's episode is funded by the Patient Center Outcomes Research Institute, or PCORI, and the goal of doing these reactions is that Samira, the founder of Manta Cares, can have researchers, doctors, people in the oncological field onto our main show, and they can talk about their research or work. In turn, the podcast club allows us to discuss as patients, caregivers, or members of the cancer community and kind of react to the way in which we can apply these research topics into our daily lives. Maybe to put it more simply, this is where theory gets put into practice for cancer patients and their loved ones as we gain more knowledge about updated standards of care in the world of cancer. And so today, what we're going to be reacting to is an episode where Samira interviewed Josh Carter, who's an oncology nurse at the Stanford Women's Center, and they are talking about how pain management is a very complex topic in the world of cancer and how to understand the difference between palliative care and hospice care and some misconceptions around pain management. So I'm going to hand this over to Marissa, and she's going to interview me, and I'm excited to be in this seat today.
Thank you, Mike. Yes, and thank you for your perspective on it. I think the first thing that you jumped into and I want to ask is, what is the difference between palliative care versus hospice care?
That is a great question. And it's one that comes up very, very often in cancer and often in situations in which cancer patients and their loved ones weren't expecting to have the conversation, because I know that as an otherwise healthy, now 37-year-old who's had stage 4 cancer 3 times, it's a weird, way to frame things. But for the most part, outside of dealing with metastatic melanoma a bunch, I've been healthy otherwise. And yet I was approached about palliative care both during my last diagnosis and my first diagnosis. And both times I said, "What do you mean palliative care? I'm not dying." I mean, I said that verbatim the first time. And they had to say, no. Palliative care isn't when you're dying in any way. I mean, hospice doesn't necessarily imply that either, but that is the more, accepted version of it. Palliative care is just when you are prescribed pain management methods to ease the burden of treatment that you're going through and make your life more comfortable. And there are tons of both inpatient and outpatient settings for them, whereas hospice is more towards end of life, towards intensive treatment in an inpatient setting. And so this is a huge issue, because when people are asked, would you like to approach palliative care, they're often meeting it with resistance, when in reality, it should be something that every cancer patient at least has a working knowledge of, so they can say, yeah, I'd love to have some pain management in my life, because cancer treatment often is very uncomfortable.
Yeah, I feel like there is just so many misconceptions around definitions of what something means, and then also the gap in knowledge that you just don't know that palliative care is going to help you and is with pain management, which I know is something else that they kind of get into about this episode, which, kind of what pain management strategies really helped you, and what are some misconceptions that you heard about as you were going through it?
Yeah, pain management, it's a tricky subject for a lot of cancer patients, and it has been one for me as well, because you are exposed to some of the most toxic therapies possible. I mean, chemotherapy is famous for inducing side effects and pain, not to mention a lot of times when you're going to have more invasive surgeries, there's going to be a different set of pain management needed for that, alongside like longer term managing your side effects. And I know that we can use me as a specific example. I'm very health conscious. Prior to getting cancer, I didn't even like to take pills, which is now kind of a joke because I take 20 of them a day or whatever. But I was not into taking painkillers, and I usually don't respond well to them. And so when they were prescribed to me, at first I had the trepidation about taking them, on an individual basis. But there's also a second side of that, in which sometimes patients are worried that they're going to become addicted to these opioids or painkillers. And similarly, they're worried that they're going to be judged for taking them. And the last thing you need when you're a cancer patient is more stress on top of the actual cancer you're dealing with, on top of treatment, and on top of pain management. So better education about pain management and dispelling these misconceptions about, like, can I ask for painkillers? Is it okay to take them? What is the risk of, becoming addicted to them? I think that's going to be critical in future cancer patient care.
The epidemic of just pain management and pain pills across the country is obviously so huge. So it's understandable that somebody going through it would be like, oh, am I going to be addicted to this, or is this really necessary? Like, can I just deal with the pain of going through it? Like, how severe will it be? What do I need to do? So, yeah, that's such a tough place to be.
It's coming from like two different ends of medical education and or rumors. For example, I mean there is an opioid epidemic in the United States and the world, but I think that that is a much different thing than, hey, I'm a cancer patient and I need to deal with this pain. Can I have a prescription that allows me to deal with it? Because not only do you need to deal with that, it's just the last thing on your mind is, am I going to become addicted to opioids while you're a cancer patient?
Yes, right. You're like, am I going to live? I want to live. I want to like beat this and get through it and get into survivorship, which is yeah, so great that you've been able to do it so many times, which is crazy. Your story is still so amazing to me and so baffling.
I'm pretty good at getting cancer, but I also seem to be pretty decent at beating cancer. So I should
There you
probably
go.
stop at least one of them, if not both by extension. But here we are.
Well, do you have like quick tips for patients or caregivers who are going through this?
Yeah, I think that connecting the dots from being vocal about your needs as a patient and a caregiver, I think that's important because you learn that I brought up not liking pills as something that I had experienced, and you learn to understand that there's no free lunch in any of this stuff. Like if you're going to make it through cancer treatment, there is often a cost benefit for the things that you have to ask for. But ultimately, when you're in treatment, it's your number one job in the world to get through treatment, which I think patients have a lot of issues with at the beginning. I know that I did, because you don't want your identity to just be a cancer patient. But I think the best way to approach it is, okay, for whatever isolated period of time, hopefully isolated, meaning you can try and get through treatment and into some sort of remission, or try and find a place in which you're managing your cancer as best as possible, finding stability. You need to treat it like your job. And this goes for, caregivers as well. They are put in situations that they would never have imagined they were in. You don't go through life thinking, okay, well, how can I care for someone when they get cancer? But once you're in that situation, I think taking it very seriously and being willing to reach out to any resources who can help you get through it is the best approach.
I love your insights and your opinion on everything. It's so nice to hear you talk about it. And also, yeah, just so happy for you getting through everything and being able to share your experience and really help everybody around you understand this and kind of get through those misconceptions and know how to better themselves while they're still in it. So
Yeah, well, I appreciate it. And it's one of the reasons that we're here at Manta, trying to help other patients learn from these experiences. So
yeah.
thanks for flipping the script and doing the interviewing today.
Yes, of course. Thank you, Mike. I'll talk to you soon.
All right, thanks. Bye,
Bye.
Marissa.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.